for updates. Several of you are regular attenders, and we appreciate you. And then for those of you that this is your first time joining us, thanks for joining. We want to do these monthly. One question we're going to ask near the end, so just think about it, is if you want to be kind of put on a permanent list for these meetings, so you don't have to register for them every time. We intended these to be a replacement for the tours that we did monthly, and we're imagining it would be new people every time. But what's happened is a bunch of you just kind of join us every time, which we find is fantastic. So we want to adapt to that. So we'll ask you about that near the end. Let me just run through a little bit of our agenda. We will do a quick set of introductions with everybody, including a couple new team members that we have at the Poverello Center in our development team. So we'll introduce them. Claire Bopp, our shelter manager, is going to do a quick update about what's going on with Winter Shelter, the POV, kind of the main operation stuff there. Then we have Tara Jensen from the Montana Budget and Policy Center or Institute? Center, gotcha. Tara is also a Poverello Center board member. She's going to give us a little bit of a update about what's going on at the legislative session, particularly around some legislation that's impacting the Poverello Center. I will do a little bit more of a kind of broader update about what's going on. Amy can't join us today. There's a big meeting thing that she's dealing with today, so you get me instead. But we'll just kind of do a broader update on a couple of issues that are happening. Zach, our volunteer coordinator, will talk a little bit about the point in time count that just happened last week, and then we'll wrap it up. So that's kind of our agenda for our time together. In the effort to keep us rolling, I'm going to start us with introductions. If you could just tell us quickly your name, what your connection is to the POV, staff, supporter, volunteer, donor, that sort of piece, that would be great. Okay. And then what is your favorite Valentine's Day candy? And I'm going to ask my new colleagues on the development team to go first. We do have a growing team. You have noticed you've been getting emails from Sarah Penix about these gatherings. She is our new communications coordinator. And then Liam Morrison has jumped ship from the hot team and is joining us as our new development associate. Mia Lehman, who was our old development associate, moved on to a new position at the end of December. So we'll welcome those two folks to our team, and I'll have them start our introductions. So Sarah, why don't you go first?
Hi everyone, my name is Sarah Penix, and I started as the communications coordinator at the POV. This is my third week, and my favorite Valentine's candy has to be Twix. Those are the best.
And I'm Liam Morrison, third week on the development team at the Poverello Center as a staff member, and I would say my favorite candy is when Reese's comes out with the heart-shaped Reese's peanut butter cups.
Nice. Tara, why don't you introduce yourself?
I'm Tara Jensen. I am a co-director of the Montana Budget and Policy Center. We're a nonprofit research organization dedicated to advocacy for families living on low incomes. And I'm also on the POV board. I just got my 1-year anniversary under my belt. And I gotta hit it with the Reese's with the chocolate situation. That's the only, I let myself have one each holiday with whatever version it is.
Cool.
And then popcorn, are we popcorning?
I'll just call on folks. Deb, why don't you go next?
Thanks. Hey, I'm Deb Stapley-Graham from Parkside Credit Union. My new-ish office is just down the street from the POV. Parkside Credit Union had chosen the Poverello Center as one of our Parkside partners a few years ago, gave a donation that was significant to us and some time and volunteer work. And as we like our partnerships to happen this way, it's stuck. And I love being at the POV. I helped at Thanksgiving, and that was my best Thanksgiving, I think. So awesome. Big believer. So thank you.
And your favorite Valentine's Day?
Oh gosh, candy? I think honestly Kit Kats.
There you go. All right, Marilyn, you're next.
Okay, I'm Marilyn Lamayich. I'm retired from corrections. So when I worked, I would occasionally meet people who were living at the POV. And also I've cooked there with my church, UCC, and I've really missed doing that during COVID. My favorite candy is butterscotch squares from C's Candy.
Nice. Jim.
You mean me?
Yep, Jim Cook.
Excuse me. Is it okay if I take my mask off? Because you guys are so close to me right here. I'm within 6 feet of you. I'm within 6 feet of all of you guys. So is it okay? I'll take it off
Awesome, Jim.
and show you my smile. I'm not associated with the POG. I'm an outsider. I'm a tree doctor. So I deal with trees with dementia, and sick trees. And I'm the only doctor in Missoula that still makes house calls because nobody brings their tree to my clinic, So anyway, so if you have a sick tree, I tell my clients to give it 2 aspirins, but don't call me until morning. Okay, now the reason I'm connected here now, there's a fellow who's sleeping out by the river behind the Walmart, and I'm trying to get him to go over to the Johnson Street, North Avenue place. And I'm working on getting him over there, but he's got so much material in his tent. If he leaves it very long, it gets stolen away from him. See, and he hoards a lot of stuff. So anyway, I like to see what's going on with the POV and assist as much as I can. And then for my candy, I don't have candies. I just suck my thumb on Halloween Day.
There you go.
That's my favorite.
Steve, you're next.
Steve MacArthur, UCC, and I volunteered at the POV, donate to the POV. And I'm very happy to have these monthly catch-ups just because we're so isolated to understand, since we can't be there in person, how are things going, what the needs are, that kind of stuff. So glad to be here. My favorite candy is the Dove's dark chocolate.
Cool. Brian.
Brian Derry, a strong supporter of the POV. Let's see, dark chocolate, but not Dove.
Excellent, Brian. Lynn?
Hi, I'm Lynn Tenefoss, and I'm a supporter of the POV, and I definitely lay claim to those Necco's hearts with the little sayings on them.
Great. Cindy?
Hi, I'm Cindy, also a supporter of the POV, and I spend a lot of time during my day job looking out my window right at the POV here at the YWCA, and am just always impressed by the work that's being done by the staff over there.
Thanks, Cindy. Ethel?
Hi, I am not connected with the POV. I've never volunteered or anything, but I am a regular donor and interested in finding out a little bit more, especially wondering how the camp outdoor facilities are going. Favorite candy is just chocolate in any form.
Great. And Bill?
I'm with Bill Johnston. I'm with First Security Bank and do the community relations. We're a donor to the center, and we believe in this mission. And I'll echo Ethel, any candy I love. So it's keeps my size up, and I appreciate that. So
Great.
Hello, everyone.
Hello. Zach, you settled back down there?
Yeah, can you hear me?
Yeah.
Okay, cool. I'm Zach Malden. I am the volunteer coordinator at the Poverello Center. And Valentine's Day candy, I don't know, maybe like some form of chocolate or sweet tarts or something like that. I don't really know.
Cool. And then I'm going to call on Claire last, but I realized I didn't share what my chocolate was, which is basically anything made by Posh Chocolat. But that's because the owner is a good friend with my wife, so I have to say that. Anyways, Claire, why don't you introduce yourself and then go right into your bit.
Yeah, my name is Claire Bopp. I'm the shelter manager of the Poverello Center, and I like, you know, I don't mind the candy hearts. They're fine. The white ones are the best, I think. But so as far as like a winter shelter update, is that sort of
Yep,
yeah?
we're at your part. Yep.
Yeah, so we over at the Johnson Street Warming Center, we've served 379 unique individuals since the beginning of our, you know, since we opened on November 1st. So yeah, 379 individuals. We're averaging about 100 people a night, I would say. And we've had some challenge. I had challenges running reports, and I don't know if it's a me problem or the like service point problem, but I would say at the POV itself, we've been sleeping around 70 to 75 people per night since November. So that's a lot of homeless people in Missoula, which we know, but it's always, you know, to see it in the shelters can be overwhelming sometimes. I think we talked about, Jesse asked me to sort of share some things that I found interesting over the course of the winter. And one of the things I wanted to share was that we have been seeing, this is an anecdotal observation, but a lot of us who have been with the POV for a long time have noticed that at the Warming Street or the Warming Center on Johnson Street, we've been serving a lot of young people. So a lot of people between the ages of 18 and 25, 26, which really surprised us. And we're not sure what about the facility itself is drawing younger people to us, or maybe they don't want to be outside. I'm not 100% sure, but that's definitely an observation we've made. And luckily we've had a handful of community partners coming in. We have the space, you know, maybe not the chairs or like whatever, but we have the space to meet with people in a socially distant way. And so the Human Resource Council and a couple other agencies are sending their transitional aged youth case managers to Johnson Street to try and capture some of those individuals and meet with them and connect them to resources. So that's one interesting observation I wanted to share, the young people. And it's a low barrier facility, so we have a lot of intoxicated individuals, which is always challenging. Definitely adds a new element of working with the people we serve. But I'm confident. I feel like I can confidently say our staff, just by virtue of being there around some intoxicated people, have saved lives this winter by being there to observe and call emergency like EMS when it becomes necessary. And with the intoxicated individuals, one surprising, or maybe not that surprising, but something I've also observed is that we have been doing a pretty good job of connecting people with resources that are available. A handful of our staff members are in recovery themselves. And so when somebody goes to the hospital, maybe 2 or 3 nights in a row, they can navigate the difficult conversations of, are you ready for treatment? Or is that something you're interested in? And we have a surprising number of people who are interested in taking them up on that offer, whether it's case management or a more formal treatment, you know, facility. But the challenge is there is not a lot of treatment to be had in our community. So when we reach out to Turning Point or other places, the admit date is weeks out. So we're not able to make that connection in a timely manner, but we're having those conversations and having a lot of, in my opinion, successful conversations. So that is sort of, is there anything I missed, Jesse?
I think that's perfect. Anybody have any questions for Claire? And we'll be talking more about like hot team and stuff like that in a bit, but go ahead, Lynn.
Sorry, I'm just curious if you have a sense of what proportion of the total homeless population those 170 people represent.
You mean between like the people we're sleeping every single night?
Well, I'm wondering how many people are in total homeless in Missoula, and what proportion are you serving with those two facilities?
You know, that's an interesting question, and I don't know. Yeah, Zach might be able to field this better than me, actually. Zach, do you have data?
Yeah, I could say quick answer is it's a relatively small proportion. And then later on, when I talk a little bit about the point in time count at the end of this, I can go into a little bit of details of why I say it's small.
Thank you. That'd be great.
Yeah, and there's, I mean, there's lots of different ways people are experiencing homelessness, and we serve a slice of that. Like, you know, our friends at the YWCA are working more around families. We don't serve families. We only serve 18 plus, so anybody that's 18 and under is not getting served by us. So our slice of the pie is significant, but not by far the only slice that's in the community. So we can talk more about that when we get to point in time. Brian, did you have your hand up?
I did. The number of folks that you're serving this winter versus last.
Mm-hmm.
So yeah, I would say that the numbers are a little bit, I would say, higher this year. And I pay attention to these kind of longitudinal numbers a little bit more. Last winter was a pretty warm winter, and not as many people came indoors. Also, one of the things that happened last winter is that more communities started standing up their own warming shelters or winter shelters over this winter time. So Kalispell, Hamilton, Bozeman, some of these other places actually had their own shelter facilities that didn't have them before. So there was less people coming into Missoula from places that didn't have resources, which we actually think is a good thing, a good progress. Some of those have been able to continue to do that again this year, some have not. And then of course, you know, COVID's a really big issue this year in terms of causing more homelessness. We have more unsheltered homelessness. And that's one of the reasons why we did the warming center, is to create more space, spread out space for people to come in. So I would say that it's up from last year. Last year was quite a bit down from what we'd been experiencing in past years before that. This is still probably a little bit below the peak we had maybe 2-3 years ago. But it's still, it's still pretty high.
Can I add something to that just real quick?
Sure.
I think one difference this winter that I've seen, and again, this is just an observation compared to last winter, it's not like hard data, but is more people like touching the system but not entering it. People living in their cars who maybe come in for a meal or want a printout of something or would like to send a fax, who aren't necessarily our clients yet, but are on the periphery maybe of homelessness or at risk of losing housing, or are maybe living out of their cars. I feel like there's a lot more of that, in my opinion, this year than last.
Yeah, totally. Okay, thank you very much, Claire. And Claire has to move on to another meeting, so she's gonna take off, but we can answer questions that come up for her there. So what we're gonna move to next is invite Tara Jensen to spend a few minutes talking to us about what's going on with the legislative session.
Yeah, so it's a lot. The session is intense as always. I'm gonna focus primarily kind of on what's happening with the budget right now. I'm happy to answer any questions that you have, and if I can't, I can always follow up. I also, unfortunately, I'm gonna get my budget update at 1. So I'm gonna give you what information I have, but if there's something else. So basically what's happening is the kind of one of the first starting point motions. So the budget starts in the House Appropriations Committee, and then it divides up into a number of sections. Section B is the one that houses DPHHS. So each of those sections of the budget gets broken up into a subcommittee, and they are the ones that do kind of the initial hearings and kind of go through that early action. And then the bill goes back into a whole to the Appropriations Committee in the House. It goes to the through that process of hearings within the House committee. It goes to the House floor, then it goes to the Senate, and then it goes to the Senate Finance and Claims. That's their budget committee. Goes through that process, goes to the Senate floor, and then either the House approves all of the amendments or they go into a free conference committee. That was the shortest, most simplistic version of the budget. I'm so sorry, it is so much more complicated than that, but that's the nuts and bolts. The one thing that is concerning kind of for the POV and anyone, you know, in my realm where we're looking at services that help and impact families, individuals living on low incomes, is the early action in that DPHHS subcommittee. So Section B, one of their first starting point motions was to roll back the budget. So instead of starting the budget with 2021 actuals, they rolled it back to 2019. There's a couple issues. I mean, first of all, that's a problem in and of itself. There's additional problems because Medicaid expansion before 2019 wasn't in House Bill 2, which is our budget. It was a statutory appropriation. So that's kind of a complicating factor that we're not really sure how that's going to work out. And then also there's a new division at DPHHS, which deals with kind of the foster care, child well-being, and I just blanked on the name of the division and I'm embarrassed, but anyway, that one. So that wasn't a part of, that's been since 2019. It's supposed to be a budget neutral, but I think that there's some complicating factors. I just pulled up, so the starting point motions rolling it back is about $1 billion cut. You heard me, $1 billion cut. Now, there's some people who say it's not a cut because it's not actual yet, but what it does mean is we're going to have to build that back up over time. So instead of talking from an actual starting point, what communities need, you're rolling back and trying to build back up your base. So it's not $1 billion of state funding. So a lot of DPHHS funding comes with a federal match anywhere between like 3 and 9. So Medicaid expansion is about a 9-to-1 match. You know, other ones are in the 3. So there's a varying levels, but so it's a $209 million general fund cut. And then if you kind of factor in the federal match, so if we don't throw in our state part, we don't get the federal match. That's when you get up to the $965 million in total funds cut. You know, that's like 18 million with a 96 million total for senior and long-term care. Addictive mental health disorders is 28 million general fund, which comes at about a $34 million federal. So there's a lot of things to worry about right now. We are hearing that, and I haven't heard, I don't think they've made any action this week. It's mostly a series of hearings, and it looks like any sort of real action subcommittee is going to kind of happen at the end. This could be a very long drawn out process. We might not see any sort of restoration and whatever those restoration levels look like until maybe it's on the Senate side. It's kind of an unclear picture right now. So, you know, if you have time and are so inclined, definitely starting to call subcommittee and ask for those to be restored. You can always, not to plug my own organization, but if you want information, we're like the geekiest place you can get it. If you really want to dork out on budget and taxes and all sorts of stuff, Medicaid, housing, the montanabudget.org. I'm gonna send a big email with like how you can get involved, how you can testify. There's some great videos our partners have produced on why testimony matters. And you guys can start to get plugged in, but it's definitely something that will have an impact. Actually, we were talking today about it. Today's Groundhog Day, and it feels like Groundhog Day because these are the same programs that took the cut in 2017. And the POV was so great to work with the YWCA and a couple shelters across the state to really kind of highlight that these cuts had an impact. They had an impact on the population of the POV, both in terms of reduction of any sort of supportive services, people who had, you know, were housed, kind of lost housing because they didn't have case management. I mean, these, as we all know, as supporters of the POV, impacts ripple out. And some people are lucky enough to never see those impacts. And then places like the POV see them every day in numbers and stories. So it's not a great place we're in, but follow the Montana budget. You can follow our social media and all this stuff, and we can keep you up to date. And I can periodically provide updates to Jesse and keep you guys in the loop if you're so interested. How was that, Jesse? Did I just throw it all out there too fast, or did I do okay?
That's perfect. No, thank you. And I'm just going to say, just add a couple of things to this. One is that in the Missoulian this Sunday, there is an op-ed that Amy and Cindy and several other shelter directors across the state put out there, kind of talking about the consequences of these cuts and how they are pretty similar to what happened back in 2017. Just for context, you know, when we see the peaks of homelessness in our community, and when you know the POV was hitting real crisis numbers, like serving 200, 210, 215 people a night, were right after those 2017 cuts. And our real fear is that we're going to see these cuts on top of really a pending homelessness. I don't want to get too crazy about it, but just
an economic crisis.
Yeah. I mean, crisis. I mean, I want to say worse than crisis, because, you know, with what's happening with homelessness related to COVID, you know, so many people that were on the brink are not are going to tip over, and once any sort of rent eviction sort of moratoriums lift, we could see some really bad news in terms of numbers climbing. And so we're deeply worried about this. Those two things together, we could see dramatic growth. And just put a number on it, the Montana, or the Coalition to End Homelessness did a study and predicts that it costs about $35,000 a year per person experiencing homelessness in a community. Just in all the auxiliary costs and stuff like that. So it's not that we're not, we're saving money, we're actually creating more costs in a lot of ways when we allow people to fall into to more homelessness. So we really encourage you to reach out to your elected officials. We will do a follow-up email from this gathering with some take-home tasks that you all can do if you like, but this is really critical, and why we're bringing it up in this space. With our closest allies. So that is that. Any questions for Tara before we move on to our next piece?
Jesse, Bill Johnston, I just wanted to, Tara, it's great to see you, and thank you for such a concise explanation of the process. Having lobbied for 30 years in the state legislature, it's never easy, and I think you did a great job for people that want to know a little bit about it, but you can't get in the deep weeds because it's confusing to everybody. But I want to just echo your comments about, and Jesse's, how far back this rollback will hurt, because you'll spend all your time now trying to get back to your current funding levels, and there's no addition. So any new need, the inflation, the cost of living, you know, everything that has gone up is just simply wiped off the budget sheet when you go back 2 years. Now, the legislature years ago would also go back as far as 10 years and make it claw back. And it's not a way, in my opinion, I'm trying not to be partisan, I'm an independent, but just in the policy part of it, it's not a great way to manage your accounts, because you're assuming that everybody can just go with a loss of 2 years of funding. And as you know, it's with biennial funding, each new funding uses the current funding. So your increases that you might get will be smaller, in addition to being rolled back 2 years. So you have a lot of work ahead of you, but thank you very much for both being on the board, but also caring enough to be in a position to lobby and help those that we need to help and should help. So thank you.
Thank you very much, Bill. Yeah, I think that's right on in terms of where we're at with a lot of this stuff. So it's so important. Any other questions that folks have or comments on that piece? All right. Well, as I said, we'll have a follow-up email going out about that. And it looks like Sarah just posted the op-ed in the chat. So if you want to check that out, that went out to newspapers across the state this weekend. So just going on to some other things that are happening. This is the part that Amy normally would be talking about. I'm going to start by kind of going where we're looking at this in the going future of what's happening. So one thing that we're tracking really closely right now and have been in conversations with the Montana Department of Transportation is their plans to they want to clear the encampment that's next to the Reserve Street bridge. We have been encouraging them not to do that and working pretty closely with them to ask them not to do it. The reasons that we're doing that are, and we recognize that the Reserve Tree Camp is not an ideal situation, right? We more than anybody, I think, know that. Like, we have staff down there on a regular basis. But the reasons that we are really discouraging them from making a move right now are a couple. One is that the CDC is recommending that encampments like that not get cleared right now. It's just for safety reasons, for COVID spread, those types of things. Dispersing encampments like that is not considered safe by CDC standards as it relates to COVID. And so we would encourage MTD around that. Secondly, you know, they want to do it sometime in the next couple months. And this is a terrible time to clear those encampments. There are people down there, I think, as Jim knows, that have, they've got a setup down there where they can be warm. If they get moved out of that, they're going to lose all that kind of material that keeps them alive in terms of the weather. And so moving them now is really going to be quite dangerous to those individuals that are doing that. There are not a lot of people down there right now. We've done the whole community has done a pretty good job of getting people to move to other locations. So a lot of folks that were in the encampments have been utilizing services at the Johnson Street Winter Shelter. And then our allies at Hope Rescue Mission and the United Way have set up the safe encampment zone out on 93. And so there's only about 20 individuals right now that are utilizing the Reserve Street encampment. But they're also the people that are some of the most resistant to making a move and those sorts of things. Our worry is if the MDT clears out the encampment and then puts up fences, that many of those folks are just going to find a way back in there. You know, a fence can be easily, you know, go by a quick wire snips and you're back through that fence. And all that's really going to happen is that they're going to make it harder for service providers like ourselves and first responders like the police and EMS to be able to access and get in there. So we're encouraging them not to do that. We haven't been super vocal in the community about that yet because we've had some one-on-one dialogue going on with them, including with the Sheriff's Department. But there might be a time in the near future where we're going to be reaching out to our community base and asking you to contact MDT and then express that you know, work with us in terms of hopefully stopping that. We've got long-term strategies to get those folks into housing, and there's things that are working, and we've been working really hard to get people into things like the Cornerstone Permanent Supportive Housing Unit that just opened, things like that. So, you know, there's a long-term strategies there, and this is not the time to clear those encampments. So that's that situation. Moving down the calendar to March 31st. So March 31st is the date that we stop having funding for the winter shelter. It's also the date that Hope Rescue Mission stop having funding for the safe camping zone on 93. And so we're anticipating that is going to be a challenging moment. At our next online supporter update, so the one that will happen in the first week of March, we're going to have the HOT team come and talk about that. But we are going to need the community support around rallying up some resources, making sure people have warm weather equipment. Because as we know in Montana, April still can be cold. And we are going to have a lot of folks that are going to have been sheltered that are going to be moving into being unsheltered again. And we're working on strategies to update that. We'll update you on those strategies at our March online supporter update. So that's the those pieces. The other thing is that we want you to save the date. About this time last year, we were having we had one of the last in-person fundraisers that happened in Missoula. It was our annual leadership breakfast. In fact, I think it might have been the last in-person fundraiser in Missoula. Obviously, we still can't do that. Getting everybody in a small space is not safe because of COVID. But we're going to pilot a new idea, and it's going to be June 19th. Hold the date. We're calling it Picnic for the POV. It's going to have a similar model of being a table captain, hosting, free meal, but it's going to be outdoors, and we're going to have it on the baseball field, the Paddlehead baseball fields, with their big jumbotron and all that cool stuff. And so we'll in the follow-up email we'll be sending here, we'll be asking folks if anybody here wants to be a table captain or I guess it might not be table, but it'll be a picnic blanket captain for the Picnic for the POV this year. We'll be focusing on our homeless outreach team for that event. We've been able to expand it because of federal dollars for COVID resources, but those monies are going to expire at the end of June, and we're wanting to raise enough money to keep that team fully staffed at its current staffing level through ongoing, because we think they're such an important resource right now. So that's really the next big thing there in terms of the fundraising events and all that. So anybody have any questions about the little bit that we had there before I pass it to Zach and have him talk a little bit about the pit count? Yes, Lynn.
Yeah, I'm just curious, is there an opportunity to extend that time by a month or two for the warming shelter? Is that space available and it's a question of money, or are there other issues?
It'd have to be a negotiation with the city. It costs us about $150,000 a month to operate it. And most of that funding this year came through a community development block grant fund that was allocated specifically at COVID interventions. And that's what this is a COVID intervention, because we had to cut our capacity so much at the main building. As the POV's primary fundraiser, I do not see another avenue to figure that out. Now, if someone were to walk through the door and say, hey, here's $300,000 to keep it open for 2 more months, and the city was okay for us using that facility for 2 more months, I think that we would do what we could to make it happen. But it's largely a funding issue. It's incredibly expensive and the difference here versus past years is this facility is running 24/7, whereas the extended winter shelter that we've operated in the past at the Salvation Army was just an overnight shelter. So it was quite a bit less expensive.
Is it looking like the new administration's funding, if it passes, would have any options in there for you?
There's been talk of some aspect of that having some response for housing crisis interventions. I have not seen, and we have not seen any specific legislation, pieces of that legislation that would cause for more resources in that area. It's not been necessarily included. I think they're much more focused right now on a lot of the funding is going actually towards schools and helping schools get and stay open more fully, which I appreciate. My wife's the principal of other schools in town, so I don't want to, fight them for their money, but we do. It's our hope is that there's going to be a worse housing crisis because of the pandemic, and that our hope is that there's going to be some federal resources with that. We just haven't seen anything yet.
Yeah. Thank you.
Any other questions about any of that?
Jesse, I have a little question about
Sure.
the safe camping space. That's also going to end at the end of March. Is that what I'm hearing you say?
Yeah, and we don't, just so you know, we don't run that. That is actually run by Hope Rescue Mission and the United Way. But yes, they are funding, what is funding them is the same kind of package of funding that's funding the, help fund the Poverello's shelter Johnson Street facility.
Wow.
So yes, funding runs out. I do not know if they've got other capacity or plan. I mean, their footprint's a lot smaller than ours over there, and I'm guessing that the expense is a little bit different. And I don't know, the landowner that owns that land is I know him personally, used to serve on a board with him, and is pretty supportive around these issues.
Yeah.
So I would be shocked if that landowner like removed anybody from that space.
Yeah.
But what might happen is the staffing over there that they've got will be less available.
Okay.
But don't quote me on any of that because I don't actually know the details of it. Any other questions about that piece? All right, Zach, let's talk about Pitt.
Hello. So the point in time surveys, they just wrapped up last week on Thursday. Just a little information about the point in time surveys. They are an annual effort initiated or coordinated by the Department of Housing and Urban Development under the federal government. And they're national, simultaneous, across all communities in the nation, where we attempt to survey everyone experiencing homelessness in the sheltered or unsheltered environment. Keyword is attempt, because it's very hard to survey everybody who's experiencing homelessness. And so, yeah, it happened on Thursday. It went fairly well. I was pretty much in charge of coordinating the sheltered surveys here in town. I mean, the POV in Johnson Street is the largest shelter in the city. So we pretty much do most of our numbers are the highest for the sheltered count. And it went really well. It's a pretty unique event where we have a lot of volunteers get trained up on conducting the surveys. And then we have other agencies in town that are kind of working to do their surveys with the clients of their own. And so at this point, the data is still kind of coming in, and it still needs to be like edited and refined and stuff. I'm seeing that we conducted approximately 300 surveys this year, give or take. And this is, not only sheltered people, but also people who are living outside in encampments around town. Also people staying in transitional housing, hotels and motels under certain vouchers. So it's kind of everyone to the best of our knowledge. And then last year we surveyed, I think it was 354 people. So this year it appears to be 50 less, but that doesn't mean that there's 50 less people experiencing homelessness. This year was, with COVID, also pretty challenging to identify people a little bit, I would say, compared to last year and stuff. But just like to kind of bring it back a little bit to Lynn's question earlier about the number of people that are in our shelters and how that is, like what that looks like and the greater makeup of the total number of people experiencing homelessness in town, that is really hard to answer. We do know that like about 20 to 25% of people in town who are homeless fit the bill of being in the unsheltered environment, living in encampments or in cars and whatnot. And then the other people that we're able to survey are typically sheltered. So it could be either at the Poverello, Johnson Street, or other transitional housing programs in town. But 350 last year and 300 this year is certainly, it's not an accurate representation of truly the number of people who don't have housing. It's very hard to survey someone who's couch surfing or someone staying in their car somewhere in the county. It's impossible to do that outreach and just to connect to those people. And I would say that, I don't know a specific percentage, but that's a huge percentage of people. And so that's kind of what we're dealing with. But anyway, the data nonetheless is pretty important. It's kind of a basis for congressional funding. Last year, I think the state received around $2.5 million from HUD, and about half of that went into Missoula. So it's incredibly important, especially for this community, because we have a lot of people we serve the most people. You know, we're a larger town as well in Montana, so naturally a lot of the funding comes to our city. So that's kind of, I would say, a brief overview of what happened. And you know, one interesting thing is a lot of communities across the state chose to do observation only. So they would just be like, that person we know is experiencing homelessness, one, another person, two. And we actually did pretty in-depth surveys this year. So it was a shortened version than last year, but it was still about 15 questions. So next year, we might be looking at better data than a lot of the communities across the country, because our volunteers are brave and amazing. And we had a lot of safety protocols in place that just, you know, made it run smoothly. So that's kind of interesting to know. And then, yeah, so, I mean, I don't know if you guys have any questions about that. I hope I did a decent job of kind of painting that picture, but.
Zach, I would ask, compared to the times when you would have folks come to, say, the First Methodist Church and receive services, did that tend to draw more people to be surveyed at that time, or did you note? I mean,
Great question.
Yeah.
Yeah, so that brings up a good point that I totally forgot. Typically or historically, the day or the week after the point in time surveys, we have various site locations in town where we would deliver resources, like Steve just mentioned, the First United Methodist Church having a meal. Also the Project Community Connect is a annual event that happens the day after the point in time count. And this is essentially just incentivizing people who need those resources to come and access them so that we can survey them in hopes that we're catching people who we weren't able to identify on the night of the point in time. A lot of those events this year couldn't happen. And Project Community Connect didn't happen after the point in time count this year. It might happen this year, which is great. But at this point, it's just not realistic to have, you know, 100 agencies under one roof and then, you know, the community coming in and accessing them. So I would say that, yeah, that definitely affected the number of surveys we conducted. Which is really unfortunate. Yeah.
Any other questions? I know, Lynn, you had a question that kind of dovetailed on that. Did that capture kind of what you were hoping to get?
Yes, thank you. I was just curious about who's been left out of this process, but that was very helpful. And I guess, Zach, would you say if you counted 300 that you think there could well be another 100, if that's the 75% to the 25% that are missing?
I would say, I mean,
or even more.
My best guess, it's probably more. You know, if we're able to identify 300 people through the surveys on the night of the point in time count, we're probably talking more like 600 people in the county who are experiencing homelessness, just because of the high number of people who are couch surfing or staying in cars or staying with friends and family, multi-generations under a household, or things like that. So I don't know, but that would be my best guess. And just from talking to people who are knowledgeable about it in the past, like Teresa Williams, she tends to say we're dealing with about 500 to 600 people who are experiencing some type of homelessness or housing insecurity. And just the college campus alone, I don't know the data, but it's a pretty high number of students who are just rooming up together, who, you know, are staying on a couch trying to go to school, and that's just the U, much less, you know, everyone else. So go ahead, Jesse.
I was gonna say, Lynn, I know that a couple of years ago I was involved with the youth count, and we knew that we counted probably 15 youth that were experiencing homelessness as part of the point in time count. But when we talked to MCPS through their process, they had identified at least 150 unaccompanied homeless youth within the MCPS system. And, you know, those unaccompanied youth are, you know, none of those were getting counted by the point in time count. So there's real big gaps out there. There's also, like, you know, one of the big gaps it's hard to get to are, you know, people camped up in RVs, like in neighborhoods and stuff. If you ever drive or go out the South Side Road, that dirt road that runs kind of along the south side of the Clark Fork as you head west of town, my wife and I just were curious about what was out there and drove out there last summer. And we saw multiple people that were living out there in campers. And those are folks that aren't getting counted either. You know, we don't have the capacity to send people out there. So, and so those populations are not being counted. Some of the more remote encampments that exist out in the community are ones that aren't getting counted. So I would say that even that 500 number is probably low.
Yeah.
So, and it's challenging too. They do these in the winter, which of course there's a certain level of migration that happens with homeless populations. So we do have folks that'll, you know, when it gets cold here, will peace out and head south, and then cycle back up when it gets warmer. So warmer climates tend to have higher counts because of that level of migration. So.
Some other interesting stuff too, just to say it, what's always interesting to think about is the majority of people who are homeless in Missoula became homeless in Missoula, and an even higher percentage of people experiencing it in Montana, our Montana natives, became homeless in Montana. And the number one reason people report being or experiencing homelessness is because they can't afford to pay rent. That's the number one reason people cite it. Always worth keeping in mind.
Yeah. All right. Sarah, this is that moment where I asked you to remind me things that I forgot that we've talked about we wanted to make sure we brought up here.
I believe we have covered everything. Just also to put Missoula Gives
right.
on all of your radars.
Right. And so along with if hosting a picnic table or a picnic blanket at the Picnic for the POV is not your thing, we'd encourage you to think about Missoula Gives being a fundraising champion for the POV during Missoula Gives, which will happen at the end of April. That'll be coming up fast in supporting the POV. And then I guess the last thing, just you know, in the we need help thing is that we are going to supply drives, and particularly drives for warm weather gear, outdoor equipment like sleeping bags, tents, and tarps. That type of stuff is really kind of going to be on the top of the list of needs we're going to have as we roll through March. So if you're, you know, our banking friends, Deb, Bill, if there's something like in terms of collections that you all could be doing, our church friends, I know we've got UCC and First United Methodist folks on this call, folks from the university, you know, those are the types of things that like those supply and gear drives are going to be pretty critical moving into that time. People have come into shelter, which has been great. We've been able to connect them to resources, but they're not going to necessarily still have all the gear that they need to survive when it gets cold, when these things sit down. And I know that's a big part of what the POV hot team is pretty worried about moving into the future. I don't know, Cindy, would you like to, is there anything from your side of the world in terms of family homelessness that that this crew would be helpful to know about in terms of as we move into the spring?
You know, I think right now our biggest challenge is that through our rent assistance program for families, the cost of rentals is just so high that we are having a hard time, even though we have almost $300,000 a year for rent assistance through a HUD grant. We're having a really hard time spending it down because our families right now who are looking for rentals are competing against each other for a very limited supply of truly affordable rentals. And we're worried about that. We're worried that no matter how much money we have, we're not going to be able to house all the families that need housing.
Yeah, and I would agree with that. I think we're seeing that on our end. We have, you know, probably last time I asked, it was like, you know, 15 to 20 individuals with housing vouchers in hand, meaning like as soon as they got a place, they have their rent paid for. There's just not a house out there for them. And so that's the, you know, places like the Y and us, in a lot of ways, we're a Band-Aid until we can figure out the housing situation. And that's a crisis that we need to be thinking about as a community moving forward. So thank you very much, Cindy.
Jesse, Deb has her hand up, I think.
Oh, I'm sorry. Did I miss
that?
Thank you.
Sorry.
Just very quickly, no, it was good to hear Cindy's. That's really compelling as well. I was just wanted to ask about or cold weather items. Are you looking for things primarily that are new? Are you looking for us to raise money that can be used to purchase new things? Are you okay with things that are gently used? What's the price there?
Well, I'm actually going to call on my new colleague, Liam, in the development office, just because we did steal him from the homeless outreach team. And so he has some direct line experience with the kind of gear that they can need. So Liam, can you talk a little bit about like what kind of stuff we're hoping for there?
Absolutely. I think the most important question to ask is, would I be able to carry this if I have a place to put it? So the biggest things that we could really use are hats, gloves, things people can physically wear on their own bodies, because a lot of people are pretty maxed out on what they can store. And new is always really, really helpful and appreciated. If for nothing else, they're a little easier to pack up and disperse out. That being said, we can take gently used. It's just a little trickier logistically to distribute.
Mm-hmm. And I would say that backpacks are always in high demand. So like those are things that we can use. And then tent, sleeping bags, tarps. Like as we move through the thing, those are the things that are going to be a little bit more expensive moving into the future and collecting that kind of stuff. So. All right, folks. Well, just want to say, hey, thank you all so much. Oh, Brian, you got your hand up. Sorry.
Yeah, my question regards vaccinations for COVID for both staff and for clients, and how that's going to be coordinated with the public health.
Yeah, thank you so much, Brian. That's a great question. Some of that is still we're still working through it. The POV had been put into Group 1C from the original planning, and then the governor's working of that priority list put us a little bit further down the list there. We are getting some of our staff vaccinated right now that are affiliated with our Valor House program, because they're considered a congregate housing setting. I don't know how they're different than our main facility. It's the way some of this stuff has been figured out is a little opaque to me. But we are actually working very closely. We have a long-standing partnership with Partnership Health Clinic. And my understanding is that when we are up on the queue, we are going to be getting vaccinated through Partnership Health Clinic and that priority. But that could be a little while. Like some of our staff that are like social workers and things like that have the medical connections have started getting vaccinated. Other staff that don't have that kind of medical linking are going to be a while. Clients is going to be even longer. One of our big concern actually is convincing clients to get the vaccine. We're worried that we're going to be the folks being willing to get vaccinated within the population we serve could be pretty low, just because of mental health, substance abuse challenges there. So we're already starting to talk about that with our client base and are going to be educating our community there. But I'm kind of assuming we're not going to see our pretty widespread vaccination of our team until probably in a couple more months still.
And then Deb and Bill have hands raised.
Okay,
Jesse.
Bill and then Deb.
Thanks. I just wanted to give you a compliment. Your latest issue of the people at the POV and I think it was your winter issue. It's great for us that don't interact with you every day to see that and the human stories, the people that are volunteering like Jim and Rob and Mia. I think I remember Mia wrote something about donating. That's all just to reinforce how important that is to keep us informed, but also there's tangibles that we can touch. We can see what the difference being made, what it is, and just want to compliment you on the issue.
Oh, thank you so much, Bill. We really appreciate you saying that. We enjoy putting that together. So I appreciate that. And Deb.
I'm good. The hand was for my last question.
Oh,
Okay, cool.
sorry.
I can. Cool. All right, folks. Well, I think we're past our time. It's a little after 1 o'clock. Again, really appreciate all of you and all you do for the for us and the wider community. If you've got any further questions, you feel free to email us at donations@thepoverellocenter.org. Yeah, we'll see you next month. March 2nd will be our next one of these.
Great. Thank you.
Liam, Zach, Sarah, if you could hang, that would be great. Cool. Well, that went really well.
Yeah.
Yeah.
Yeah, I didn't know when to speak